I'm Victoria Zyulina. Currently, I'm doing research in a hospital for special surgery, Weill Cornell. And first time when I heard about COVID, I was finishing my Ph.D. in one of the beautiful European countries, Austria. And that was a great time because I just came back from New York and I jumped on the last flight before the shutdown happened and I met pandemic there actually. So we were all not believing that this is a real threat. So everyone was hoping that it will come down soon and everything will be back to normal within a few weeks. I think as an immunologist, so I was working in the Institute of Pathophysiology and Immunology, we were not only surprised, we were really interested to see where it goes, because when you know the scientific part of it, you kind of realize that this is something that is more serious than most of the people think, and that politicians kind of underestimate the situation a lot. And as a medical doctor, I was threatened by all the things that are happening, and actually I was more worried about the low-income countries and the third world countries, because I immediately realized that well-developed countries will deal with this very easily, and the whole burden of the pandemic will be on the low-income countries, unfortunately. During the pandemic, I was privileged because I had a medical education, and although I was working as a researcher, I could immediately switch in like a matter of weeks. And while my research was paused, I could actually help people in another way. I asked around in my medical university if there is a need for some jobs, and medical staff jobs were of course very stressed. And I came from the lab and I talked to my colleagues and in the clinics, and they said, okay, you should definitely come here. We have a lot of vaccines right now that we need to inject, and you can step in and actually do injections for the staff. So this was the first, round of the vaccination, and the healthcare workers received the vaccines first. So I was actually giving the vaccinations to all the colleagues of mine, medical doctors, and I was vaccinating around 200 people a day. So it's basically you have like 5 minutes to talk to the person, you just inject it, and then next. And I was working full time back then, and I think this is the thing that helped me a lot not to get crazy and not to stress myself a lot about all this happening, because when you're busy and you know that you have something to do and you can actually help on your side, that's a great feeling. That means like you're doing something for the good. Europe took a different approach. They were very cautious about flattening the curve really early. So most of the time we spent in the lockdown, and Austria acted very fast to prevent lots of deaths. So we did not see that crazy picture like in New York that was happening, and it was sort of safe feeling, and I realized how important is where you are and how important is what politicians do to protect people and how much money they dedicate to save people's lives.